Everybody, please take a seat. We are so excited to start this portion of our program. Now, this is really the most important part of the program. I know everybody had a chance this morning to go out into your breakout sessions, and we have a very distinguished panel sitting up here today to be able to listen to what you have to say. So I wanted to briefly introduce them. We have Lisa Hasagawa, and then we have Seema Nanda. I'm sure I'm saying this in the wrong order. I'm going to say we have Gail Knowlson from the Director of Program Support Division. We have Myron Kwan, National Director for the National Asian Pacific American Families Against Substance Abuse. We have Romero Stokes, the MPA Program Manager for Office of Health Equity. We have Jane Yu from the National Korean American Service and Education Consortium. We have Andrew Strait, who's the public advocate from the U.S. Department of Homeland Security. We have Melvin Tablas, Policy Director. Oh, okay, sorry. But we have Lisa Hasagawa in his place. And we also, of course, have Kiran Ahuja and Chris Luke who will be joining us in a few minutes. Again, the ground rules for doing this is we will be having people come up to the microphone, and I know Asian Americans tend to be a little bit shy. This is not the time to be shy. You have come here because you have had an opportunity to listen and say, I want to say something to the White House. We have minders at the microphone, and just to get us started, remember, when you come up to the microphone, say your name, say your organization, and you will have 2 minutes to present your question and end with a question. That's really a question or an ask to the White House Initiative and these people up here, this distinguished panel up here. We do want to kick off, of course, with the 4 chairs that were leading the breakout sessions this morning. So we will also be having transcribers taking notes, because at the end of this, we don't want just everybody to say, oh, we came here, we had a great time. No, that's not the point of what we came here to write our questions down. We're going to have a transcriber. We're going to say, this is the report that we have from this wonderful meeting. So to kick off the microphones, I was wondering maybe you could have Helen Kim Ho go up and maybe ask a question from the Small Business and Entrepreneurs panel this morning. Helen, and then I would like that to be followed maybe from the Immigration and Civil Rights panel. I know Tricia Sung, you're in here. I know Keish Kim, you're in here as well. And then we also would like people from the Mental Health and Services panel. I know Marianne Chung, you were sharing that, and also, of course, from the Housing and Homelessness panel with David Sutton assisting from the host committee. So without further ado, I would like a microphone to be picked up, and I would like the town hall session to begin. Remember the ground rules. State your name, state your organization, and after you state your organization, make your ask. And we have timers who are willing to time you down for 2 minutes apiece. Ready? Okay, go.
Well, I'm sure we're going to get bonked. I thought we were going to report on what the policy asks were from our business panel. And with me is Abraham Young. He is my wonderful board chair for the Asian American Legal Advocacy Center. We're the first nonprofit civil rights law center here in the Southeast. We led the small business and entrepreneur panel. We thought that would be the most quiet, and there was no shyness in the panel. People were very, very eager to speak up, and those that participated, please do share your stories and your concerns. But we were asked before we started to be able to bring up some policy ideas and suggestions that came out of that discussion. I'm going to give 3, and then Abraham will finish out. But one from this session, it was really clear that outreach, effective outreach for Asian Americans may be a little different from the way outreach is traditionally handled. Maybe typically it's good enough to have a webinar or a phone number that people can call or a place that they can go. But without the right, more Asian American staff people, and not just translators, but cultural brokers. It's more than just language. There are more subtle issues and sensitivities, and we appreciate what the White House has done and what the agencies have done. I think the feeling was that we could definitely use more and more of a prioritization from the staffing level in terms of the government arms that serve small businesses. Another thing is, especially with the small business community and government contracting, there are suggested goals of making sure that a certain percentage of government contracts go to small businesses. That's a goal, but it's not a mandate. And I think when you mandate businesses and you mandate the government to do something, and if not, there's some kind of enforcement mechanism, that ensures that more small businesses will get into the market. So we hope that the White House will consider changing it from just kind of an aspirational goal, but putting some teeth into it. I think another thing that Abraham brought up is that right now the data is collected as minorities, all minorities. At least from our perspective, what's publicly available, there's really, you have estimates, maybe guesses, how many Asians get small business loans or are in the government market, but it's not really tangible. And until we can track the actual numbers, it's hard for us to be advocates for ourselves and to advocate for greater coverage for Asian Americans. And then I'd like to say the last piece.
And one of the hottest topics in our panel session was that we were asking for greater access to capital for small businesses when they're looking for loans. The biggest challenge is loans are only available for people who don't need money. Is that true? That's very true. And so to use solid underwriting standards, but to come up with creative ways, like the Shark Tank is a very creative way to have access to people. But we don't know what that is yet, but maybe together we can dialogue and find that way to allow Asian Americans, because Asian Americans don't always have the right underwriting standards. And so that's one of the things that we were looking for.
Thank you.
Thank you. I would also like to invite the Immigration Rights in the South panel to have somebody come up and at least discuss what had happened during your session today. I know that's one of the burning issues in the Southeast for any immigrant right now. I happen to be an immigration attorney, so I see from the ground level coming up. Who would want to come up next? Okay, Tricia? Absolutely. If we could get a microphone to Tricia.
Hi everybody, good afternoon. Thank you again to the White House for this opportunity here in the South to talk about immigration and civil rights here. On behalf of Keish, Kim from GWHIAAPI, and myself, Tricia Suck from OCA, Georgia, we really appreciate all of the panelists that spoke. We talked about procedural discretion, what exactly that means and how will it directly impact us, because we still see that folks are being picked up for traffic stops, and we'd like to see if we can move beyond that and stop that process so that we're not continuously going online, filling out petitions, and trying to get folks like moms that don't need to be detained out of jail. The other thing that we talked about was with Andrew Strait, with his new office, with his new position, if he can share with the audience here what his role is, and also with Sina what her role is. Thank you.
very popular in these sessions. So, again, Andrew Strait, public advocate for DHS, Immigration and Customs Enforcement. And really, I was appointed last month, and I've hit the ground running. I just have been in numerous cities of New York, Baltimore. I've just come from Karnes City, Texas, which is in San Antonio, where it's a privilege to help open up the new civil detention facility in that region. And what do I do? What's my role? What does my team do? Well, we're trying to make sure that you have a voice, the individual. All too often, we find that you have to have an attorney or an immigrant advocacy group that has to get down to the individual level, and that we want to change. And so we have established 24 field liaisons. There's one in Atlanta. We hosted a small group of advocacy groups yesterday, and they had a field office introducing them to their field liaison. And come next week, we'll go live on our public advocate website, nice.gov, with the 24 field liaisons, how you can reach us and how we can resolve concerns and complaints. And what's different a little about my role is I'm an immigration policy attorney. I'm a career federal servant, and I have been actively working on detention reform and civil immigration reform as best as we can administratively. And so I was one of the authors of our civil detention standards, our risk classification instrument tool, and also very much involved in prosecutorial discretion. And just to head off some of those questions, I know a lot of people ask me, what is prosecutorial discretion? It seems like a new phenomenon. And myself, you know, as an attorney, it's not a new phenomenon. Day in and day out, your local police department, local lawyers, trial attorneys, Department of Homeland Security, every day we issue prosecutorial discretion. It's how we do what we do. And so recently, my director, John Morton, and the Secretary of Homeland Security have issued memoranda that says we have priorities of how we're going to enforce immigration laws. And these are very fair and balanced priorities, and they just make sense. It says we're going to go after those who have a threat to public safety. We're going to make sure we're involved in criminal institutions like jails and prisons, and those who have violated the law, not just administrative civil issues with immigration, but with criminal issues, we're going to put our resources there. We're also going to put our resources to those that have recently crossed the border, our recent border entrants who haven't established equities or ties to the community. We're also going to make sure that those who have evaded a final order of removal already, a fugitive per se, are also our priority. And I can tell you, as we're going on and doing this work with civil enforcement priorities and prosecutorial discretion, the statistics are in our favor. 90% of those removed this year have been in our priorities, and we are making sure that 90% or more of those in detention are meeting priorities. You know, the law sometimes says we have to mandatorily detain folks, and you know, we think that law needs to be changed. I know the administration and I welcome comprehensive immigration reform. And until then, it falls to ICE to understand how to quickly and effectively implement these laws. And we think, hey, if a mom or someone who is caring for an elderly mother or has strong equities, a person's in school and college, they don't deserve to be in detention if they don't need to. And so what we do day in, day out, we exercise prosecutorial discretion. We make sure those that are in detention are the ones that need to be there, and those that are removed are threats to public safety as a first and foremost priority. Thank you.
I also want to remind the panel, you have a 2-minute time limit too. Because we do want to hear the voices here. I know you're listening, but also we want to hear these voices out here. I also want to remind you that there are LAP people here with interpreters, so please try to speak as slowly as possible. After Seema responds to the immigration question, I did want to respond to the business and small business and entrepreneur policy issues as well. So briefly respond.
My name is Seema Nanda, and I'm with the Civil Rights Division of the Department of Justice. I specifically work for an office called the Office of Special Counsel for Immigration-Related Unfair Employment Practices. What our office does is we protect work-authorized people from discrimination in employment based on their national origin or their citizenship status. That means if you are denied a job because you are not a U.S. citizen or because of your national origin, and there is no government contract or government law requiring U.S. citizenship, you should contact our office. We do this in a variety of ways. We have a hotline. We take charges. We work with other government agencies where necessary. But one thing I just wanted to mention is we do a lot of work with E-Verify. We work very closely with USCIS to make sure that the E-Verify program is not run in any sort of discriminatory manner and that employers do not discriminate against people based on their citizenship status and national origin in using E-Verify. So we want you to definitely contact our office if you encounter problems in E-Verify related to national origin and citizenship status discrimination. And just one more point, I am part of the larger civil rights division. We have sections on education, housing, we have a criminal section, we deal with police profiling, public accommodations, and so I'd be happy to field any questions or thoughts related to the division in general. The division in May 2011 reaffirmed its commitment to the Clyburn versus Doe decision, affirming that all children, undocumented and documented, have a right to public, elementary, and secondary education, and the Civil Rights Division is committed to enforcing that.
I'd like to approach the panel for a brief answer to address some of the small business current issues.
Okay, hi, my name is Sharon Redding. I'm our regional administrator at GSA. I'm going to try and speak slowly. With respect to outreach, my response to that is we've done a lot of it, and because of the outreach we've done across the Southeast, I'm proud to say that and by the way, the goal, we view that as an absolute floor. That's what this administration is tackling in terms of the numbers. So in my region, 70% in 2011 went to small business. As of Q1 of this year, 84% of government contracting dollars is going to small business out of GSA. So we've made it a commitment. My commitment to you, Helen, is here in Atlanta, at the very least, let's put together an outreach event. I will bring contracting officers from multiple federal agencies. We'll host training sessions. I'll bring primes, big prime contractors so that subs can have an opportunity to meet those primes. And last but not least, I'll collaborate with Cassius and see if we can also set up a matchmaking session with potential lenders so that we can also deal with the access to capital. Is that good? Can we do that? 2 minutes, right? That was 2 minutes. So that's a pretty, at least we'll be able to move forward. And then with some follow-up questions from the audience, maybe I can address some of the other issues.
Thank you. That's fantastic. I heard a promise there. I heard a promise. So I'd like to open it up to any questions possibly from the health and mental health panel, or yes, up there at the mic.
Good afternoon. My name is Pavitra Rizal. I'm from Bhutan, and I have been living here for 6 years. And I'm representing a Bhutanese refugee. It's a new group of refugees. We are like 13,000 in Atlanta. We speak Nepali. We live in Nepal for 20 years. I lived 16 years, they live like 20 years. And my issue here today is for health panel. Like this morning, he told us that don't use your kid as an interpreter. Ask for the interpreter, but what about if the health facility, hospital, doctor's office doesn't provide? I have a lot of stories regarding the interpretation. I have like, when we request hard, we get interpretation in Hindi. That's not our language. Instead of Nepali, we get an interpreter, like male interpreter in an OBC clinic. And I want to share a small story. This happened this January. A lady was pregnant with a detached baby. The doctor knew on 3 months the baby not gonna make it, and it was risky for the mother too. But because of the language problem, she kept the baby throughout all 9 months. And we got a call when she was in a labor room. They were trying to do the C-section. We got a call from the hospital to interpret for her. I rushed to the hospital, but nurses stopped me. Like, who's gonna pay for you? We are not paying for you. You are not allowed to interpret because we are not paying. Then I said, I don't need money. I'm coming from CPAC. I want to interpret for her for free. I don't need money. Just let me help her. Please, in this situation. Finally, I got a chance to get inside, and we had a delivery. The baby didn't make it, but she's still in a bed. It's 3 months. She could recover, and she's still in a bed. But all this is just a small language problem. And I asked her, did you get any interpreter? She said yes. I said, who is that? But it was her sister-in-law. She was using. Doctor office did provide. And I would like a new, like, affordable health care to make the interpretation or the language access to everybody, even for a new group of refugees like us.
Do we have a quick response from any of our healthcare professionals?
My name is Julia Schweiam from the Department of Health and Human Services. I'm actually the Chief of Staff and Senior Advisor for our Office for Civil Rights. On behalf of the Secretary, for us, it's really important that we have this opportunity to see you in person and hear these stories. To quickly respond with regard to the Affordable Care Act, as we stated earlier today.
I'm not going to ask you to raise your voice. I don't think the interpreters can hear you.
Okay, thanks. Okay, a little closer. So under the Affordable Care Act, certainly there are many provisions that do increase health coverage for all communities, and including Asian American Pacific Islanders. Now, with regard to the point that you're raising, we hear this issue every day. There is this small provision within the Affordable Care Act called Section 1557, which is the non-discrimination provision that applies to all programs under the Affordable Care Act. In short, we absolutely do want to ensure that healthcare services, programs, activities are all provided in a culturally and linguistically appropriate fashion. My office in Washington, D.C., the Office for Civil Rights, we are the law enforcement branch for HHS. We do hear stories like yours, but we want to hear more about that. Folks can file individual complaints. You can have your community organization or big organization or family get in touch with our office on your behalf, because we understand sometimes folks may be fearful in reaching out and seeking assistance and really trying to understand what your rights are. I know we're big into websites. I would ask and invite folks, if you haven't taken a look at our website, it is hhs.gov/OCR, or Office for Civil Rights. We're here for the rest of the afternoon, and I wanted to make sure for the folks, the communities here across the Southeast, Roosevelt Freeman, if you could stand up for a moment. He is our regional manager for Office for Civil Rights. In anticipation and our desire to hear more of these stories, I want to make sure we get a chance to connect from the Secretary's office, Subhan Shima, if you could stand up. He is also available, so let us dialogue with you further. Thank you.
We're glad to hear there's an invitation to come and speak afterwards. The panelists are available. We have a question here from the floor on the left.
Yes, those who wish to ask a question through an interpreter, would you mind stepping over here to the interpreter booth so that they can assist you with that as well? So we have some here standing. We'll let this gentleman ask.
My question is about the health program itself. I want to ask, so to say, we got a Medicaid after 8 months. Without knowing our Medicaid get expired and we cannot go to the hospital in order to do the health checkup. Because on a visit, whenever we go to the hospital, the charge comes up to 15 or 25 minutes, which will be very much difficult for us to pay because every day wages is low. And it became very much impossible to those persons who have the long-term illness, so to say. So, can't it be possible for those persons to apply to give the Medicaid for more than 8 months?
Okay, so I think the question was, so can people within your communities be able to apply for Medicaid for more than a month? Is that correct? For Medicaid assistance, is that correct?
Ma'am, could you please repeat once more?
Yes, I just wanted to clarify your statement. You said, yeah.
His question is, as a refugee, when they come to the country, they get a Medicaid for 8 months. And without knowing what to do with that Medicaid, their benefit expires. And after that, once they start going to the doctor, they get a bill of $30,000, $40,000. What we need to do? Our daily wages are very low. We cannot afford to pay that bills. That was his question.
Any response from the panel?
I do, regrettably, that's not my area, but I do know that question does arise in terms of refugee access to Medicaid and health services. So I'm restating it to make sure we've got folks from the Center for Medicare and Medicaid Services here with us and our team. So we'll make sure we take that and bring back some additional information.
Thank you. We have a gentleman over here.
Hello. Okay, great. Thank you. My name is Tim Lee. I belong to the Georgia Vietnamese American Chamber of Commerce. We are located in North Cross, Georgia. And I'm going to ask about the housing crisis and the issues that we are facing at this time. We've heard this over and over again, in today's summit, that the Asian American owns about 6% of the small businesses in the United States. So therefore, there are quite a few self-employed Asian Americans. And because of the housing crisis, the conventional loan is very tough to get a real estate loan. But being a self-employed person trying to get a real estate loan is almost impossible. So we are asking, basically we're asking to see if there are any programs out there that make it easier for us to re-enter home ownership. Right now, we messed up.
My name is Ed Jennings. I'm the regional administrator for HUD for the Southeast, the same geographic area that Cham has. We do a couple quick announcements that may impact that issue and then direct assistance. You may have seen about 2 weeks ago, the Secretary Sean Donovan, Attorney General Holder, announced with 49 states Attorney General a $25 billion settlement for those who were the top 5 servicers in the country who had mistreated many people, particularly in focus, people of color, had been mistreated. That $25 billion settlement does a couple things for the people in this room. For those that live in Georgia, they have access to $817 million, up to $2,000 per person. And the Georgia legislature, through the leadership of the Attorney General, has access to $105 million for several things: for legal aid to pursue the claims related to that issue, for housing counseling related to those issues, because one of the biggest issues I would refer you and anyone else to is start with a HUD-approved housing counselor. HUD-approved housing counselor who can facilitate not even just when you're in trouble, but also putting a package together to get that home mortgage with that lender. FHA, which is a part of HUD, is the primary lender for over 50% of mortgages, particularly people of color, for Americans and Hispanics. We produce over 60% of those mortgages. So right now we have a 3.5% down program. So you even though as a small business person haven't been in that world myself, you still have to do a 1040 that shows your income on an annual basis. That document can be used to take to a HUD-approved lender, to an FHA-approved lender with a 580 credit score at a minimum to get that home mortgage. You can go to www.hud.gov. HUD can do that, and I'll be happy to have that conversation with you as well moving forward. And very, very shortly, we're about to announce our housing counseling grants this afternoon that I think the people in the room might be pleased about those announcements.
That's exciting news. Housing grants and availability of funds. Lisa?
Good afternoon. I'm Lisa Hasegawa. I'm the Executive Director of the National Coalition for Asian Pacific American Community Development National Capacity. So we are one of the HUD Housing Counseling intermediaries. But just to address your question around what to do around self-employed and the non-traditional credit and the fact that so many self-employed had all-day loans and subprime loans, there's actually a lot of advocacy that needs to happen. So in Washington, D.C., we get invited to lots of meetings with like the OCC and the Treasury and the Federal Housing Finance Administration, and everybody's trying to figure out what's the definition of a qualified mortgage right now. And so we are involved in some of those conversations, but we could really use your help about what are some solutions moving forward to be able to ensure that home ownership remains available to communities of color, particularly those in immigrant communities. We do have, so many of us are self-employed. So I would say that there's a couple of different groups who are working on this issue. We are to some extent. I think that a lot of our housing counseling organizations see this issue over and over again, but also the Federal Reserve Bank is doing research on this issue. The Asian Real Estate Association of America is also trying to develop new products to ensure that people who are self-employed also have access to good loans. So it's really more on the advocacy level. It's really around the product development. And I think that we really have to work together across the community and also with our Latino brothers and sisters to look at some product development and even with some financial institutions as partners.
Thank you, Lisa. I've heard, again, the call to work with our other minority groups. The AAPI minority groups alone cannot do it. We need to be partnering up with other minority communities to get our voices heard together. I see some people lined up on this side of the room. We would like to take the next question.
So, Pratham, जनतामा नमस्कार गर्दछु। मेरो नाम देवीचरण काफ्ले हो। मेरो संस्था क्याथोलिक हो। म अहिले क्लास्टन सिटीमा बस्दछु। मेरो भनाइ यही छ कि सबै हामी धेरै भुटानीहरू 65 वर्ष उँभो कटेका वृद्ध वृद्धाहरूले अंग्रेजी भाषा पढेर सिटिजनशिप निकाल्न अथवा नागरिकता निकाल्न गाह्रो पर्ने भएको हुँदा इन्टरप्रेटरको व्यवस्था भइदिए हामीलाई सुविधा हुने थियो भन्ने सम्पूर्ण भुटानीहरूको भनाइ यही छ।
First of all, I would like to thank you everybody here, and my name is Devi Charan Kapre. I am a Bhutanese refugee. I live in Clarkston. The problem we are facing is that we already crossed 65 years, and in order to get the citizenship, we need a requirement of English language, but we cannot face that interview. So there should be interpreter arranged when the interview is going to happen for the citizenship interview.
Well, I can't address the issue of the CIS. It's another agency that does citizen immigration services that I what I can tell you in terms of language access for immigration proceedings and immigration detention and enforcement issues. We have made sure that we have access to interpreters at every level. We have also made sure that our officers are trained in language issues. We have deployed at our facilities limited English proficiency posters that allow for folks to point to the language of which they know, so we can actually use interpreter services. Oftentimes in asylum hearings and or interviews, an interpreter is used at any point that it is needed. And so the government is working to make sure that those that have limited English proficiency issues, there's an interpreter available at all times paid for by the government.
And we have Twit Long here also to be able to answer that question from the initiative.
Hi, my name is Twit Long. I work on civil rights policy and the White House Initiative Pacific Islanders. Regarding citizenship and integration of newcomers and refugees, this is a really key priority for the initiative, and we have done a lot of work to focus and highlight on these issues and work with the Department of Homeland Security to understand and get and disseminate the resources that are available for newcomers out there. One issue that we have worked on is availability of English classes for individuals. We understand that there are less resources to help organizations, community colleges, and community-based organizations to create those English classes that fit your community, that fit your lifestyle, and fit, when you have to go to work and you can only learn English at night or on the weekends. And so what we ask you to do is work with organizations like the Center for Pan-Asian Community Services and give them feedback about what kind of classes you need. And they are the organizations on the ground that are eyes and ears that can tell us, the federal government, what needs are out there in terms of English language learning. We have also held roundtables across the nation on how we can better integrate individuals so that they can have be able to work, be able to learn the language, be able to engage with the government as well. And so we place a huge priority on workforce issues, civic engagement, citizenship issues.